In this short video, I'm going to take you through the process to quickly be able to see what plans are available and what the monthly premiums are. Now, to quickly recap, the first thing you want to do is to follow the instructions directly above to create your account with Connect for Health for Colorado, as well as select Get Assistance, find a local assister, type in your agent's license number, then authorize that agent to act on your behalf. After doing that, you can go ahead and select Find a Plan. Now, before we find a plan, I want to give you a quick tip. When you're going through that initial account setup, please note that you will be asked if you want to see if you're eligible for any type of financial assistance. If you answer yes to that question, it's going to take you directly into the Medicaid application. Now, the Medicaid application is required if you are going to either be eligible for Medicaid or if you want to get an advanced premium tax credit. And in order to get the advanced premium tax credit, you need to apply for Medicaid using the PEAK application system, at which time at the conclusion of that you will be denied Medicaid. Then they will provide a denial code, and that denial code will then be plugged back into the Connect for Health Colorado system in order for you to be able to continue your application. But for now, before we do that, I do suggest going through and just selecting Find a Plan, and let's take a look at the plan options and see what the premiums are. So to do so, we're just going to go ahead and from the top navigation, we're going to select Find a Plan, and then we'll just select the Continue button. I'm only looking at health insurance at this time. And it's going to ask about my health status and if I'm expecting any upcoming major medical expenses. You can skip this. Just so you know, if you do fill it out, it doesn't have any effect on the plans that are available or your premiums. It just helps them, the system, to try to recommend suitable plans for your needs. But in my case, I'm going to select Skip and View Plans. Now, by default, the system is going to show the plans sorted by lowest cost premium. And for most of you in the Kaiser service area, no surprise, Kaiser is going to be the least expensive plan option out there, again using the Kaiser HMO network. Now, we do have some options. You can see that in my case, I have 78 plans available. We do have the ability to go through and filter these plans based upon the monthly premium. You can see I could set up a filter where I only want to look at plans with premiums between $0 and $394, and perhaps I want a little higher deductible, so let's look at something between $2,000 and we'll say $5,000. Then you can see you have some other options here, as well as we could go through and we could select if we're interested in any particular carriers. We could go ahead and select those, and then we will select Apply Filter, and you'll see we went from 78 options down to just 3 options. Now, just so you know, you do have the option to be able to select up to 3 plans to compare them, and it will give you a side-by-side benefits comparison of, again, a maximum of 3 plans. Or in this case, let's say that that we like the Humana plan, this particular one, so we went ahead and added this to our cart. By the way, you can always see the plans that are in your cart simply by clicking on the cart button here, and then you can verify that. By the way, I wouldn't give too much credibility to these ratings because they're certainly not remotely accurate for the quality in Colorado, in my opinion. But anyways, in this case, I've added the Humana plan. Now, if I'm not applying for an advanced premium tax credit, I can now continue, and then I'll provide the initial payment, do a final review, and then purchase and enroll. For those of you who are wanting to see if you're eligible for an advanced premium tax credit, you can then go back and go back into the Medicaid eligibility portion. You will need to again fill out the PEAK application, get a denial code before you will be able to complete your application process.